Welcome everybody to a special edition of our speaker series for MMN Awareness Month. This webinar is a panel discussion on being your own best advocate, especially in healthcare settings. Multifocal motor neuropathy is a very rare disease. We estimate about 40,000 global patients, and that presents a very unique situation for getting diagnosed, getting the right treatment, and working with your doctor to help you feel the best you can when neither you nor your doctor necessarily knows what to expect. Hopefully, this panel discussion will shed some light on the questions you should be asking in those appointments. Throughout MMN Awareness Month, the GBS-CIDP Foundation International is hosting lots of virtual events to raise awareness of the condition, the diagnosis process, etc. We'll hear a little bit from our panel today about that process, but the meat of this discussion will be about the conversations we should be having with our doctors. To learn more about our panelists' patient stories, visit the MMN Awareness page on GBS-CIDP.org. For now, I have some questions that I'm going to pose to each of our panelists, so let's get started. The first question is for Pam. So Pam, first quickly tell us where you're from, and then tell us why you think it is important for MMN patients specifically to be their own best advocate at the doctor's office. Was there a certain experience that triggered your passion for this topic? In full disclosure, this topic was one of Pam's better ideas throughout our MMN awareness planning.
Great. Thank you so much, Chelsea. Hi, everyone. My name is Pam Sopis, and I have MMN. I was diagnosed in 2017 after about a 7-year journey of symptoms and progressive weakness. I think I advocated for this topic of advocacy, likely because it took me 7 years to get to a diagnosis. And when I finally did have a diagnosis, my family doctor looked at me and said, "Pam, you're 1 in a million." And I said, no, I'm actually 1 in a couple of 100,000, I think. And he said, "No, because you kept coming back and you kept advocating for yourself, and you kept saying something's wrong and this isn't the answer." And so I think for me, it was it's so important to be to talk about your problems, to be I think I used in Clive's podcast, positively persistent, and to persevere, because very few people know anything about MMN, and I knew absolutely nothing. And for me, I think the journey, the fortunate part of my journey was that my progression was very slow and gradual. And so for a little while, I wrote things off. And then when I went to my doctor, who then did send me to a neurologist, the journey was slowed by some misdiagnoses of a trapped nerve. And I think for me, the other thing that really was so interesting about that journey was just really that I had not connected my weakening hand, because that had been explained away to me with a limp that had developed during my pregnancy. So I had a sense that something wasn't right. I kept looking for answers, but because I was looking at 2 different problems, I had never connected those 2 things. And without a very long and in many ways frustrating journey, I still managed to maintain a sense of looking for answers. And I think had I not continued to look for answers and advocate for myself, I may still not be diagnosed. And I at some point I went to my doctor because my one neurologist looked at an MRI and said, "Yeah, you're fine." And so I went back to my neurologist, and at that point we had noticed atrophy on my leg. And I said, "So I'm supposed to just live with I called it a pirate leg for the rest of my life." And so fortunately, he said, "We're missing a plan here." And he then reached out to a different neurologist. And long story short, like another neurologist later, I ended up with a diagnosis. But even that diagnosis was advocacy was required for that, because the first time he saw me, he was thinking MMN, and I did not have the GM1 antibody elevated. And, from my understanding and talking with more and more people, a lot of people don't actually have that GM1 antibody. And so he sent me away and said, come back in 3 months. I came back in 3 months with no further answers and said, okay, so tell me again why you don't think it's MMN. And he said, okay, we're going to try IVIG and see what happens. And so had I not brought that up with him, I don't know how much longer I would have had to have waited. So it's really important to be prepared and to be a little pleasantly pushy. So I think that's why for me, this topic is so important.
Pam, thank you so much for sharing. I love the pleasantly pushy and the positive persistence. And I think the key word in both of those is keeping that positive attitude and approaching this as wanting to be part of the solution, right? Rather than kind of coming with that complaining attitude. Did you feel that having that positive attitude helped them, see that you were wanting to work towards a solution?
I think in some instances, yes. So with some of my healthcare providers, definitely that positive persistence, certainly with my family doctor, that was really instrumental in him listening to me and taking me seriously. I think the first neurologist was a bit of a write-off. Unfortunately, sometimes you just encounter those people and you have to recognize when you have seen kind of hit a roadblock. So I think it's really about latching on to the people who are there to advocate for you and finding a way to get those people to help advocate on your behalf. Because unfortunately, still, in a perfect world, we're completely patient focused. Everybody is having a good day, and everybody is, really like trying to get to the bottom of whatever's ailing you. Unfortunately, we don't live in a perfect world. We have, healthcare systems under really high demand. We have, for me, it was a 4-month wait list to see a neurologist. So I think it's really trying to latch onto the people, to find those key people where you can, and really use their influence as well, if you can at all. But I do think, I think keeping your cool is so important. And I've had some talks with some people who clearly, I've had some interactions with neurologists, and sometimes they are difficult. But I had talked to somebody who just went in with a very negative mindset. And I think what you have to always remind yourself when you're in these situations is it is like, my mom used to say, you attract more flies with honey. And
Exactly.
so I really do believe that. I think that if people like you, and it isn't, to me, from a health advocacy standpoint, it shouldn't be like this. But if people like you, they're willing to do more for you. So I think that's really just to try to keep your calm and keep your cool when you're in with somebody. And even if they're, sometimes they're not being as thoughtful as they could be, is to really just center your energy and keep it in a positive space.
Yeah. I think, you mentioned teamwork, and that's great. And I think it's a great transition to our next panelist, Richard. Hi, Richard. Thank you so much for being here. So Richard, quickly remind us where you're from, and then I want to focus on a specific piece of your story and kind of building, I think this will build naturally on what Pam was talking about. But you went for second and I believe third opinions, right, for your diagnosis. So, how did that come about? What drove you to hear from those doctors, and kind of how did that teamwork work out for you in the end?
Yeah, and thanks for having me, Chelsea. It's great to be here. And again, my name is Richard Sperry. Just turned 50 a few days ago.
Oh, happy birthday.
Thank you. Thanks for, I'm not sure if 50 is one to celebrate, but I appreciate the nice wishes.
It's the new 40.
That's right. That's right. I live in central New Jersey in the Princeton area, just about an hour from the foundation headquarters, which is great. I have 3 teenage daughters, hence the lack of hair here. Lot of stress. But no, everything's great on my end, and I'm a patient living with MMN. Was diagnosed in early 2020 after a much shorter process than Pam's. It wasn't 7 years, but for me, the 18 months or whatever it took was enough. It was pretty intense. Really presented some pretty big challenges that, yeah, I agree with Pam and being positively persistent, pleasantly pushy, a lot of P's. I think that's critical with some of the news I got along the way. It was hard to stay positive. Like many MMN patients, unfortunately, I was misdiagnosed with ALS. And that misdiagnosis came after about 18 months of progressive symptoms, weakness primarily in my right arm and right hand, which were essentially rendered useless as the diagnosis process went on. And similar to Pam, I would just reiterate the importance of being an advocate for yourself and not taking no for an answer and asking questions. And I first saw an orthopedist, then I started seeing a neurologist locally. During that time, I was also seeing a rheumatologist, a chiropractor, really just making sure that I wasn't leaving any stone unturned and any questions unanswered. And it was really, I think all these providers were struggling to figure out what was going on, but I'm glad, and at the time it made me feel good that I was at least doing my due diligence in trying to get to the bottom of it. Eventually, though, my neurologist locally just couldn't figure out what was going on and suggested I go to an academic center of excellence. So my first stop was the University of Pennsylvania in Philadelphia, not too far away. And that was where, after doing their own EMG tests, they delivered the misdiagnosis of ALS. And as you can imagine, being 45 and otherwise good health, three teenage daughters, as I said, devastating news for my family and I. My sister immediately stepped up and really came into the picture and was a tremendous source of support for me. She first came with me. She and her husband came with my wife and I on our trip to Boston, which was where I got my second opinion at Mass General. And I think a lot of ALS patients are encouraged to seek a second opinion because just like MMN, there's no clear diagnostic blood test or imaging test for that disease. So we made it up to Mass General, saw a woman who's kind of the thought leader in the ALS space, and she confirmed the ALS misdiagnosis. So devastating news. I had been holding a glimmer of hope that ALS might not be the case, but kind of hearing from a key opinion leader, as I said, and getting that news, the confirmation was tough to hear. Again, my sister was at my side, great source of support, and maybe she's a little more pushy than I am, and was really advocating for me to kind of continue to ask those questions and push and advocate for myself when I was kind of not ready to throw in the towel, but I was just beginning to process and kind of accept that ALS misdiagnosis. So I had an appointment at the Mayo Clinic in Minnesota, and at this point, we're in January of 2020. No offense to any viewers who are from Minnesota, but I wasn't too thrilled about going out to central Minnesota in the middle of January. But my sister, again, was behind me and said, no, let's just go out there. You never know what you're going to hear, or they're going to find. So we did. We went out to central Minnesota in January, got some balmy 35-degree weather. And out at Mayo, they told me they weren't gonna let me go home until they figured out what was going on with me or really confirmed everything, which I thought was an interesting approach. They did their own EMG tests. My neurologist called me up right afterwards and said, yeah, she wanted to see me in her office. So my sister and I trudged back over there, and I walk in and she's like, I'm going to cut to the chase. I don't think it's ALS. And just my sister starts crying. I'm a little more cynical, so I'm like, all right, tell me what you think it is. And she's like, well, I think it's something called multifocal motor neuropathy. And I said, I've never heard of that, but it sounds great if it's not ALS. And so she kind of explained to me what it was, instructed me to initiate IVIG therapy when I got home. And thankfully, I responded to that, and am on a really good cycle now of getting infused every 3 weeks, and am symptom free, and really grateful for my journey and where I am. But I think, as you alluded to, Chelsea, bringing your family into the fold and having them at your side, and it could be family, it could be friends. I think that's a critical piece. Both during what I think for most people is a really challenging diagnosis process. And then when the diagnosis is confirmed, and even though I was so happy to have MMN and not ALS, it's a very isolating disease. And having my sister knowing what I'm going through, having my family know what I'm going through, and when I did give subcutaneous infusions a shot, my daughter was there at my side when the nurse came over and kind of walked us through how it's done, and being there for moral support, being there to help you ask questions, being there to bounce ideas off of it. I think kind of taking a team-based approach to disease management with family and friends is critical.
Yeah, I am definitely hearing this recurring theme through you guys of this team effort that it takes to get the right diagnosis, to process all of the emotions, because, you know, we're talking about being positive with the doctor and trying to work with them as a team. But at the same time, as a patient, you're feeling a ton of emotions, and it can be hard to be positive. So having somebody to help kind of center and balance that and bring back and bounce some of those emotions off, I can see how that can be extremely helpful. Not to mention the wealth of information that was probably thrown at you. So did you find it helpful to have your sister there to also absorb some of the information and then you guys piece it together later?
Definitely. She's a veterinarian, so she has much more of a medical and scientific background than I do. So it's definitely helpful to have her there to kind of process information, ask follow-up questions of the providers, et cetera. And I think what you just said, Chelsea, is very true, is the roller coaster of emotions that even almost 4 years post-diagnosis, we as patients still go through. And certainly in my case, again, elation that it's MMN and not ALS, gratitude that I'm in the good shape that I am, but also isolation and not, you know, it's 3 years before I met Clive, who was the first other MMN patient that I met. And I still feel uncertainty. And though I'm in great shape now, I'm only 50. And how is this disease going to progress? And what's my life going to be like 20, 30 years from now? So
Yeah.
Yeah, even though I'm doing well, it's still very much an emotional roller coaster.
Yeah. Absolutely. So, you know, we're talking about how to be your own best advocate here. And, you know, a takeaway from this part of our segment could be asking for help, asking for somebody to be with you, to help you be
Yes.
your own best advocate, and to advocate maybe when you can't for yourself. And with that, I think we can go to our final mystery guest here, Clive. Welcome, Clive.
Thank
So
you,
first,
Chelsea.
Clive, remind us where you're from. And then the question I have for you is
Yeah.
kind of wrapping up our panelist deep dive here. What advice would you give somebody who's presenting with symptoms of MMN? Let's assume they don't yet have a diagnosis, but what would you tell somebody who's just starting on this journey to diagnosis? And Richard alluded that, you know, you were the first patient that he met, so I think that you might end up in this role often in your world now. So what advice do you give?
Thanks, Chelsea. It's an interesting question. So I'm Clive Phillips. I live in New Zealand, originally from England. I was diagnosed with MMN in late 2019. My diagnosis story is one of ignoring symptoms for an awfully long time. So probably for about 7 years in total. Until with 1 or 2 visits to the doctor thinking something was a bit wrong because my hand wasn't as strong as it used to be, but that kind of got very easily dismissed as, quite frankly, not doing enough exercise, and maybe the natural aging process, shall we say. So when I finally presented to a doctor, my GP, and as kind of, I think there's a problem here, it was pretty bad, and he very quickly recognized this was not something that he could kind of bat away, and so relatively quickly got me into seeing neurologists, and they equally, my neurologist said at one point he'd never seen anyone with such weak hand strength and poor hand function. So that led to a 9-month diagnosis period, but that's pretty quick. In my case, unlike Richard, ALS was ruled out relatively quickly, although it wasn't talked about until they ruled it out in a very offhand way, actually, when I think, oh yeah, no, we don't think you've got ALS. But I think, I mean, I just want to emphasize what we've already talked about, really, is that support from others. And I absolutely went through the whole journey with my wife. The interesting thing is, I think she only attended one appointment with me. I probably should have brought her in much earlier. And there's 2 reasons why. I'm not naturally the pushy person. I'm, you know, maybe that comes from my military background, where it was drummed into me that pain is merely weakness leaving the body and you've got to fight through it. And so complaining in inverted commas isn't part of the gig. Just get on, suck it up. Princess is quite commonly a phrase that's used in our household, aimed at me, to myself as much as anything else. So I will often, in that kind of situation, will underplay symptoms. I'll probably find myself, whether it's deliberate or not, conveniently forgetting symptoms because I don't really want to talk about them. I don't want to think of a particular thing as a symptom or a problem. So there have been occasions more latterly where my wife will step in and go, but you need to talk about X, Y, and Z, which is also happening, Clive. And I'm like, yeah, okay, fair enough. Or she'll say, no, I'll use language that might give the impression something wasn't really a problem, because that's how I'm trying to deal with it in my head. And Anne will step in and go, no, he's basically talking rubbish. And this is what you need to know. And we see that in other circumstances with other family members going through things where it's really beneficial to have someone with you. So I think that adds a perspective. Not all of us, you know, and it's finding someone who can articulate things for you. And that is very hard when you're dealing with it yourself. What advice would I give? And interestingly, this is something that happens a lot of late. People randomly approach me and say, we're going through this thing. We might have MMN. We might be CIDP. It might be ALS. We're not sure which way to go. What's my advice? I think there are multiple parts to it. One is Pam's advice, which is solid. Keep persevering. Keep asking the questions. Don't take no from an answer. You know, I'm going to say what Richard said now. Ask for a second opinion. And even if they've got it right, you know, play on the fact that the neurologists, in my experience, generally, and certainly my treatment, they actually like a challenge, most of them. They like a weird case. Most of us are a bit unusual and a bit weird. So play on the fact that triggers their kind of the bit of their brain that still wants to solve problems. They're not in that job to be dealing with mundane things. Otherwise, they probably wouldn't become neurologists. So keep playing into their kind of inner Sherlock Holmes and try and encourage that. You know, asking them. I think asking as many questions as you can about what does this mean? What does that mean? What are you looking for? I find it was particularly valuable to me while someone is doing an examination, asking the doctor what they're looking for is really helpful in both your own understanding, but also then potentially when you go back and you can research, and particularly my neurologists have been very good at explaining what they're looking, the diagnostic differences. So we're doing this because that would tell us or might rule something out as much as rule something in. So I'd encourage people to ask kind of why certain tests are being done. And yeah, I mean, that's just keep persevering. And I mean, none of the systems we're in, whether it's the US system, whether it's Canadian, British, New Zealand that I'm in, none of them run as quickly as we might like. So get to know, and this is the classic. It's like if you're working in a business, get to know the boss's PA. Get to know your GPs, the nurses, the receptionist. Get to know, and it comes back to Pam's thing about have them like you. Get to know your neurologist secretary. My neurologist secretary can do magic if you're nice to her. You know, she'll find space in the diary. She'll work around things. So it really is, if you can, invest a bit of time building those relationships while you're going through the process. Yeah, I mean, it's all kind of common sense, but there's absolutely no doubt that, you know, I'll often say that someone will say, oh, how long should you? I haven't heard back. And my natural inclination with most things is to go, oh, yeah, they'll get back to me. But this is the one time in your life when you're dealing with a medical problem. No, pick up the phone, ring them, chase them. If it's going to be there in a couple of days, ring them after a couple of days if it hasn't happened. Just always, you know, stick your head, just have you in the back of their mind all the time.
Yeah.
I
think what's so striking
for me, really, I think.
Yeah, thank you, Clive. I think what has been so striking about this first half of our webinar here is the amount of times I'm hearing the advice to approach this with kindness. And that's really interesting because that doesn't always go hand in hand with advocating for yourself. I think sometimes the picture of advocating for yourself is raising your voice and calling and not hanging up until they come at this. But I love that, you know, what has been most effective for you three is approaching this on a human to human level and approaching this as wanting to work as a team to solve this puzzle and find the answer and get better together. I think that's really, really striking and probably easier said than done, especially when in the thick of it, right? When you have that roller coaster of emotion. So that can be a
Can
whole
I just say something?
webinar. Yeah,
I agree. I totally agree. And I think there's, you know, what needs to be acknowledged is when you're a patient, and so I actually work also in healthcare in the healthcare space, but when you're a patient, there is a level of vulnerability. Just, you know, you're sitting in a robe or you're doing like everything is like it makes you incredibly vulnerable. So even if you're a CEO or you're, you know, you're highly successful or whatever, like those things don't matter because you're still in this very vulnerable position where you're really relying on other people. So I think to try to approach with kindness, but sometimes it's stern kindness, right? Sometimes as a parent, you're stern with somebody. It doesn't mean that you're a pushover by any stretch of the imagination. I think you know, for me, the way I like to flip things is curiosity and questions. So what would happen if we did that? Like, or, you know, for example, why, tell me again why you don't think it's MMN. That's a pretty bold question, but I'm not asking it in like a kind of a threatening way. I'm sort of just curious, like, how come you're thinking it's not that?
That's a great distinction. Yeah. The stern kindness. Yeah. And curiosity. Absolutely. Yeah.
Yeah. So I think it is, I think you can be stern and I think you can be, you know, positively pushy, but I think you can still be a little bit pushy, but I think it's that you're not a pushover. Right. So I think that that's important because I think sadly, you know, our systems sometimes don't give somebody who is a pushover, like, you know, they'll let somebody fester if they're not, and if you can't do it, then find somebody who can do it for you. Yeah. I think that's like, you know, to Richard's point, to Clive's point, right? Find, I tend to be a fairly assertive person, so I felt comfortable doing it. But if you can't, then find somebody who will be that person for you.
Yeah.
Yeah,
I
and
think-
your point about falling through the cracks, Pam, I think is a really good one, and maybe you kind of shattered my illusion that in Canada there's a better healthcare system than in the US. But certainly here in the US, it's so easy, especially in neurology, to fall through the cracks. And if you're not asking the questions, if you're not advocating for yourselves, and I know this is leading into your next question, Chelsea, but if you're not picking up the phone, if you're not on your patient portal asking those questions, the care team's not going to do it for you, and they're not going to reach out to you just to check in. So
Yeah.
And I will say, so it's helpful that my best friend is a psychiatrist. So that was helpful on my journey. But what I was going to say is she told me that, in med school, and I think this is true of all med schools, physicians are taught to look, when you hear hoofbeats, look for horses, don't look for zebras. And of course, MMN is completely a zebra disease.
Yeah.
So they're looking for some, like ALS is actually a horse, I think, in many ways compared to a zebra.
Yeah.
And, ALS compared to MMN is definitely the zebra of the group. So they're always looking for the logical explanation. And, sometimes that logical explanation isn't good enough.
Yeah.
exactly.
Yeah.
And I think one of the challenges, or the worst part, he's the support, as if to prove the point. My wonderful wife brings me a cup of tea, so take your neurologist a cup of tea, and they'll help you as well. I think one of the things to factor in is I've lost my train of thought now. No, the hardest point is before anyone mentions a condition's name. So when you are dealing with Voldemort, he who shall not be named, i.e. you've gone in, you've got this weird thing. I know my symptoms, for example, started off, there was a bit of twitching. And I'm sorry, my head went to Parkinson's straight away.
So did mine.
I've got Parkinson's lodged in my brain, right from the off. And I would say I was at least 2 or 3, fairly challenging neurological examinations in before anyone mentioned the name of a condition that they thought it might be or it wasn't. And that fight, because then, as soon as you've got a name, even if it turns out to be wrong, you can then become your own researcher in a targeted way. And you can go, okay, they've said they're looking at this. What is it? Is it CIDP might get mentioned, Parkinson's, MS, you name it. You can then do your own digging in the background. You can, whether that's, Google, whether it's reaching out to patient groupings, which we've all done, whether it's reaching out to your friend who's gone through med school, or, that's the most challenging piece. And so that's where I think the more questions you can ask in that early phase about why are you doing this? What are you trying to understand by basically charging me up to the mains and zapping me with electricity? Because hopefully that might elicit that information of what they're ruling in and ruling out earlier. And I think the shorter you can make that gap of complete unknown in the system, the better, because then you really can start advocating, and there is nothing wrong with going in and saying, oh, I've read this, or I've learned this, or have, these, neurologists can be a funny, group at sometimes, but at the heart of it, they're all human beings and they all want to help you.
Yeah.
And having a conversation with a it's got to be easier for them to have a natural conversation with someone who's thought about this and got ideas than it is someone who's not giving anything.
Yeah. So I think wrapping up this segment, the three themes that we've heard is this stern kindness, curiosity, and building your team and your support system, and not discounting the schedulers and the nurses, and making sure that you make good friends with all of them, as well as your neurologist and then your own support system. So as we pointed out, we have a couple of different types of health systems represented here. So we have a rapid fire round of questions. We're going to hear from all of you, and hopefully we can start to compare how some of the answers work in different parts of the world. So let's go through these brief-ish answers just to keep us moving right along on this webinar today. So let's start with our first question. How often do you reach out to your doctor? Does anything prompt you to reach out to them in between visits? So Richard, let's start with you.
Yeah, absolutely. So yeah, and not to evade the question, but I don't have a set frequency with which I reach out to my doctor or members of the care team. It really does happen on an as needed basis. If am having some kind of recurrence of symptoms, which thankfully I don't right now, or if I have questions about optimal timing of the flu vaccine or a COVID booster, things like that. But I will say, when I have a question, I do not hesitate to reach out. And as far as US viewers might be concerned, what I find helpful a lot is to go through the patient portal, because I find getting a provider on the phone live to speak to him or her is next to impossible, and it just kind of raises my my level of frustration. And most organizations, I think, do commit to getting back to patients within 24 or 48 hours if you submit a message on the portal. So I like the fact that I know that I'm guaranteed a response. You can also be very complete in the information that you provide in a written message on the portal. So that's kind of my go-to. And again, just do so on an as needed basis.
Yeah. Pam, what about you?
So I just actually had an appointment with my neurologist last week. And so we see each other about every 6 months. I did at some point, I had 2 neurologists. I was special because I was doing subcutaneous before. And so my neurologist didn't really know much about subQ. So he had sent me to the Center of Excellence in Toronto. So I'd say I was meeting quarterly with a neurologist. But if I have any sort of pressing questions, I haven't really had the need. I've been pretty steady, stable. I think the only time I ever had to reach out was really for when I was traveling. And so I needed to, that was when I was still doing subQ. So I needed to arrange some product before I left. But otherwise, I have not capitalized I know that there is a patient portal where I am. I have not capitalized on it. I'm not even sure that there's communication available other than like test results and things like that. But usually if I leave a message and it's the comprehensive message, then he's pretty good about returning my call, or at least booking a virtual call and virtual meeting phone call.
Great. Clive?
So I, like Pam, see my neurologist every 6 months. Going to the hospital every 6 weeks, so it's very easy through one of the nurses during IVIG, if I want to chat just to the leading neurological nurse. That's usually available pretty much. If she's in the building and got a bit of time, she'll pop down. Otherwise, literally, if I ring the secretary to my neurologist, which I've only done a couple of times, and I've had a response in a matter of a couple of hours. So we're incredibly lucky that way.
Yeah.
I'm going to move to New Zealand.
I think it's once you're in, like for Canada anyway, once you're in the system, then it's a lot more responsive. It's that wait to get to that point. That is the part that is, for me, was like a 4-month wait. And once you're in and you're somebody's patient, then it's a lot easier. I don't know about you, Clive, but that's certainly in Canada, that seems to be the case.
Yeah, and it's just the relationship, and it's it's my neurologist is very much a people person. So she to her bosses, she invests far too much time in actually talking to patients. on a human level. But I think that's brilliant.
Yeah. Yeah, nothing wrong with that. Let's do 2 more of these rapid fire questions just for time's sake. So let's go to this one. Can you recall a time when you had an uncomfortable conversation with your doctor? Pam?
I've had a couple. I think one of them was really at the beginning, I was really keen on trying subcutaneous, and he really didn't know an awful lot about it. And I seemed to know a little bit more than he did. So that was a bit uncomfortable. He seemed a little like he kind of put it off and said, oh, that's not the protocol and we can't blah, blah, blah. And so, so yeah, it kind of got his back up a little bit. So I kind of describe it as a relationship with a little temperamental boyfriend sometimes, sometimes he's like super nice and we have this nice little chat, sometimes a little uncomfortable. He did eventually, I think it was very new at the time, and it was also very newly diagnosed. So I waited a little bit to bring it up again. And then I think it was just before COVID that I said, can we try this again? And then he sent me downtown. And in fact, ironically, of course, it didn't work as well for me. So I went back to IVIG. But yeah, that was probably the most kind of tricky conversation I had with him.
That's interesting. Clive, what about you?
I haven't, but I wish I had. So, and I'm going back 5, 6 years. When I first second time I went to the doctor actually with weakness in my hand, and I got that, oh well, just use strengthening exercises, get a rubber band and use that, and I wish I'd had the uncomfortable conversation then of going, really? So that's more a regret, because that would have possibly, I have responded well to the treatment, but that might have saved me a year and a half when my symptoms got significantly worse. So that's more, yeah. Don't be afraid to have the uncomfortable conversation is also the message in that.
Yeah, very interesting. Thank you for sharing. Richard, what about you?
Yeah, not so much uncomfortable conversations versus frustrating conversations, even with neurologists, and asking questions and just getting very high level general answers that frankly don't add a lot of value. And that's not to pick on those providers individually. I think it just speaks to the lack of awareness and lack of knowledge about MMN, even in the neurology community. And that's frustrating. And that's why, in my case, I feel very lucky to have found Dr. Kella at Penn, and that was through the foundation. So thank you, Chelsea. And he is an expert in MMN and knows a lot. And I'm grateful for that relationship.
Yeah, that makes sense. All right, let's do one more question. So this is going to be our closing question. What is one piece of advice you want to share to MMN patients? And then I'm going to throw you guys through a loop, kind of last minute parameters. Can you do it in 6 words or less? 6-word piece of advice or less for MMN patients. So Clive, I'm going to put you on the spot first. You already gave. Let's revisit this. Clive.
I'll use 100 where 10 would suffice. 6 words, one piece of advice.
While you think of it, I'll just explain that the 6 words or less was a storytelling strategy that we've learned recently for advocacy. So it just kind of came to me and seemed appropriate here. 6-word advice or less.
I'm ready.
Oh, Richard's ready. Richard's going to take you off the hook. All right. We're ready when you are, Richard.
Don't take no for an answer.
That's perfect. I love it. All right. Pam or Clive, who's ready?
More. I got 8. How about no?
Okay.
I got 8. Are you going to go?
Go, Clive. Yeah. So those that were ever in the Boy Scouts will know part of this. So number 1, be prepared. know your symptoms.
That's great. That's a great piece of advice for being an advocate. And one of the questions that we didn't get to was, you know, what do you bring to advocate for yourself? And being prepared is perfect to sum that up as well. All right, Pam, we're coming to you.
Take notes, ask questions.
Take notes, ask questions. Along the lines of the being prepared, I love that. That's great. Asking
And
questions.
also I had like, no one knows what the future will bring, just in terms of a diagnosis. Like none of us know, like whether you have MMN or not, none of us know what's going to happen to us in
Exactly.
2 years or 3 years or 10 years
2
or
weeks.
whatever.
Yeah.
None of us
So
do.
again, just as a quick summary, you know, some of the themes that we've heard today is that that stern kindness, which is a great phrase, that curiosity, finding a team, being prepared, and being persistent, pleasantly persistent. Don't take no for an answer. Come with your questions and make sure you get them answered. And then I've also heard you guys have no qualms about reaching out to your doctor. And I think that's maybe another piece of advice we want to put out there is reach out and ask those questions, get them answered. So with that, I think we are set to wrap up. I really want to thank our panelists here first for coming up with this concept as part of our MMN Awareness Month and for giving their time today on this panel to talk about this really important topic. We do have another webinar on, it's a very similar kind of theme. So if you're dying for more of this information, we did a 2023 webinar with Dr. Eileen Ruhoy, and that's on our website, gbs-cidp.org, called Communicating for Success at the Doctor's Office. And that gets a little bit more into how to specifically be prepared and some of those things that we touched on towards the end. Also, follow our social media for other important tips and conversations like this. This is an ongoing and evolving conversation that I'm sure we're going to have again in the very near future. Please be sure to visit the MMN Awareness Month webpage, gbs-cidp.org, for information on how to raise awareness and for information on the Ride the World for MMN fundraising event going on. The GBS-CIDP Foundation International is thrilled to bring awareness to MMN throughout February, and I hope that we'll see you at another event soon. Thank you so much for watching, and one more thank you to our panelists.